right word. My eye thing. Cause I'm about to curve the F out. Curve out. And look at, I got my pillow, my baby. My Amanda and Liz got me this. This is my comfort pillow. This is Aries. Aries Rochelle, let's go. Come on, girl, we got things to do. Woo. Happy Monday. Happy Monday. Oh, Pops, you got the... Today is the first day of chemo. First day of my journey. It's funny, I'm not nervous. I'm ready. Yes, we're gonna go ahead and shrink this tumor I got.
How many more treatments you got after this?
I have four more treatments after this.
Okay.
You know, and I'll be doing this journey every 3 weeks. Yeah, so, you know, hopefully by September, the tumor will have shrank, and I can get my surgery and be done. Whew, let's go. This is the raw. So yeah, I was gonna do that. Gonna catch me crying, snotting, being bratty. You're gonna catch the real. Yes. Go on and make that buzz, baby. Ooh, you smell good. Mama said, man, you always bothering people.
Always.
Right?
Yeah.
Yeah. I'm not nervous, not scared at all. The only thing I'm scared about is losing me. You know, as far as my personality, and I don't care about the weight. Shit, but I ain't trying to lose my ass now. Shit. Let me be clear on that. I'm not losing all my fabulous. But I just don't want to lose me. That's my biggest fear out of all this. Yeah. Cussing people out just for no reason. You know, not talking to people. Being mean, nasty. Yeah. I think that'll kill me right there. So, I just giving it all to God right now. Let me get organized. A little bag, got a bag. Oh. Okay, I'm sorry, girl. All right, let's go.
So you'll be using your camera for your selfies while you're on chemo, right?
Yeah.
Okay. While you're not, I got it.
Okay. I'm not a video.
I don't know why you're trying to do it with all that stuff in your hand. Why don't you just do it when you get in there? Okay, we are at the Valley Hospital in Renton, Washington, oncology on the Sky
Bridge
Bridge.
of Hope.
Right.
Sky Bridge. I know that's right. Bridge of Hope. Let's go.
She got her slippers on. Everybody want to be a movie star when the camera come out. See, Valley Hospital, nice hospital,
And the
nice
sun
place.
is out. Ooh. I'm still sleepy, y'all.
It's Monday.
Sorry.
What's today's date? Monday.
Today's Monday the 5th.
And we're at 7:05 a.m. We have a 7:15 check-in.
Yeah. Sleepy. Gonna knock this day out.
I'm glad you can sleep while you're on
Yeah. Yeah.
service.
And my friend.
Okay, so for privacies, we're gonna let Tracy go with the last thoughts of how do you feel before you go in here. And for privacy, I'm not gonna film everybody that's in there.
I'm not nervous.
Just don't know what to look forward
Just
to.
don't.
First day.
Yeah, the first day. So we're all gonna find out
Yeah,
together.
you'll do your selfies, right?
Yeah.
All right,
I'm gonna
let's
do a
go.
selfie, and it's all raw footage.
All right, let's go.
Okay. See you guys. Here we go.
Yeah, so I'll just go in while they get you all linked up and stay for like the first 10 minutes or whatever. But then when you know what time you're going to be off, just call me. And I'll try and come like a half hour before you get off.
That'd be nice.
Because I'll be at the house anyway.
Yeah. Mommy was like, can I go with you?
You don't want to sit there for 6 hours.
You know.
2 8 hours.
Yeah, that's a pretty long time.
Yeah.
But I did promise to call her.
Right.
I'll be calling her. Let her know I'm okay.
When that nurse used to come to the house and I had to do that drip trying to bring down, how long was she at the house for? Do you remember?
It was, what, 4 hours?
4 hours?
Yeah. Oh, 3, 4 hours. Yeah, I remember that. I'm trying not to use my phone so much right now.
Right. I think that's
Save my juice.
exactly. Keep it charged.
I got my chargers, my portable charger.
You can charge the phone and plug it into your USB too.
Oh, yeah. But I have my portable.
You don't learn not to use that unless it's emergency.
True.
Is that doors open? I'm just hearing noise.
Yeah, you just hear the noise. Oh, there.
No, I told you that door is open out here. Yeah.
Thank God I brought them. Take 2 tablets, one mouth, twice a day. So I'm gonna have to take some now and a little later.
What do they do?
Huh?
What do they do?
Well, these pills, they help me from nausea. These are actually steroids. Yeah. So they help for cramping, any kind of pain. Yeah. Okay, so we take the 2 pills now. Whew. Okay. Took my blood pressure pills already. I brought my nausea pills because they said I'm going to be nauseated. I brought them drugs. Don't play. What else?
She's trying with that sliding door. So she's trying with that sliding door.
Yeah. And my mouth's gonna taste like metal. I gotta start buying me some suckers and little mints.
I remember before I started getting like dialysis, that's why I was tasting my mouth with metal because of the dirt in my body. That metal taste I couldn't get rid of. No matter how much I brushed or whatever, couldn't get rid of it.
Well, how did it go away?
They trying to clean the dirt out of my body. Dialysis. But they're putting it in your body. That's why you're gonna taste it, they said. But your kidneys gonna flush it right out.
Right. So, is it time for us to go?
I guess so. Get in line like everybody else.
Come on, Aaron.
You can go any place you want.
So don't spill.
Oh, baby, say your nails.
I like your color.
Oh, thank you.
So I'm getting that color next.
There you go.
Me and my girl.
Oh, cute.
Oh yeah, that's right. We gotta sit back here.
So they call you name. Yep.
They're calling people left and right, boy.
Once you get that arm bracelet, you're good to go. Once you get your strings hanging off you.
Yeah, only one person can be back in the treatment area, but. Welcome to have that I want for that patient. I remember you first time. And Terry, last name and date of birth, one more time. Thank you, honey. Whichever hand you want. And there you go. Just have a seat. We'll come get you shortly. That's what you did last time. Oh, there's, if you go where the white form begins, just take the left and it's up on the right hand side. Thank you.
Get my pink mask.
Next up.
Well, I placed the order. Stupid dummy here didn't press the button.
Oh, like to buy.
Dun, dun. So, pink gloves in my
Oh, gotcha.
push the button. Probably order them today, actually. Just been so busy, forgot. I gotta write down everything between me, you, and mommy. That's a lot. It's a lot. I got a calendar too. I'm trying to get one of the wall calendars,
Yeah.
the big ones. Definitely need that. Sure, for sure.
Like I said, I'm just glad this is once every 3 weeks
Come on.
instead
Come
of
on,
every
partner.
other day. I swear to
Come
God.
on, partner. God is so
You have
good.
nothing to complain about.
Nothing. 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 Well, they have like once every 3 weeks.
Yeah, I got every other day.
So I go back there on the 21st. Who?
Eddie.
Oh, yeah. There's a.
Terry, but she used the restroom.
Oh, she's in the bottom.
There she goes.
Thank you. Daddy? Hello.
Take any pain medicine for it?
Actually, I didn't take anything right now until I know.
Know the routine.
Yeah.
Yeah.
Yes, I am enlisting myself in this.
Yeah, he checks in ahead of you, so they're probably going in the order that you check in.
Yeah. But again, it's just a should have brought my pain medicine just in case I'm able to take it.
They might give you Tylenol here. At the kidney center, they do. If you're feeling headache, they give you. Yeah. They'll just put it in your charts that they gave you Tylenol. And what you should ask them is, even after you get done with today's chemo, is it working for the next 21 days shrinking? Or does
They'll tell me.
Yeah, or does it, I'm just saying, does the medicine just shrink today and then the next, or does it shrink over 21 days, 21 days? You get what I'm saying?
Days, yeah. Does it go in sections? Yeah.
So is it shrinking while you're not here, is what I'm asking.
Right. That's a good question.
Yeah.
That's one thing maybe I can look up. Also with my
Yeah.
friend Chad.
Yeah.
That's been my go-to person.
Yeah.
Chat.
Work for the first time. She's doing good.
Yeah. The Proxen, oxycodone when absolutely needed.
Your bones from all of this too. So right now, are you feeling like you just need Tylenol?
Yeah.
Do you take the 1,000 at a time, the
Yeah.
2 extra strength?
Yeah.
You
I
have-
do that when I'm out in public.
Okay, so that you're not like,
Yeah.
okay.
I took my Molopine.
Unloading for blood
I
pressure.
took that this morning.
You took that.
I forgot to take my statin last night.
Do you take an albuterol inhaler as needed?
Yes.
Without Xanax as needed for MRIs,
Huh?
for an MRI,
Yeah,
you take Xanax.
but I haven't taken them yet.
And then Flonase, nasal
Yes.
spray. Are you taking hydroxyzine?
Yeah, when I feel anxiety.
And are you taking omeprazole?
I got a cute one again.
Yeah.
Omeprazole or Prilosec for heartburn?
I haven't taken them yet. I just received them,
Oh.
so I haven't taken them yet. Oh, let's take this one. Yay. These.
We'll just have to go buy you a special made one of
I think
those.
you should.
Yeah,
I think you should.
I'm sure they.
They make little port access shirts where it just like unzips right here.
Oh, yeah?
Like a diagonal zipper on both sides, so you just unzip it.
Well,
You can get them on like Amazon and stuff,
I'm a seamstress.
or you can.
Yeah.
you take care of
I
it.
got a whole sewing room. That's what I say. It'd be my pleasure to make one.
Cute.
It'd be my pleasure to make one.
Anyway, no, I haven't taken that yet. I have been taking the nausea pills.
Have you been nauseous?
Well, a little bit, yeah.
The O pill and the P pill.
Yeah, they ordered me some Narcan.
Yeah.
What the hell for?
Narcan is for in case
I know
of
what it's
an
for.
overdose. Yes.
Oh, hey.
In case.
Oh, I was like, what the hell?
Yeah, so that it is standard order, especially if you have a prescription for both a benzodiazepine like Xanax and an opioid. So that's why it's a standard order for you to have, and it's
Hey,
not,
Bob, can you go pick that up from the...
Okay.
and it's not a bad idea to have.
Yeah, you're right, because now I'm on so much,
Yeah,
you know?
yeah. Just it's a just in case.
Right.
Okay, let's see here. Any, so this is just for me to get like a baseline, so I know like what your normal is and how
Right.
you're feeling. Any like headaches, dizziness, lightheadedness today?
Today, just light headache. Slight one. That's why I was asking about the Tylenol too.
Okay. Yep, I can get
Yeah,
you.
just slight.
Okay. From 0 to 10, how would you rate that pain in your head?
Right now it's just a 3. I feel it just kind of coming on slowly,
Okay.
but it's manageable.
Are you having pain anywhere else?
No, not right now, but in the lobby, I had a shitty kid. It was, she was being real shitty out there.
Where your tumor is?
Yeah,
Okay.
yeah. So and that was a 6-7.
Okay.
It's like, ah!
So that does sometimes happen. So
God.
if you're over here like, and then
Yeah,
that's what it is. Okay.
exactly.
Any like double vision, blurry vision, issues with your hearing, nose, throat, anything like that?
A little bit with my hearing
Okay.
in my right ear.
Okay.
Yeah. That's something I gotta talk to my doctor about.
Okay.
I've been having those issues, for a couple of months.
Is it like a ringing or is it an impaired hearing?
Just impaired. Yeah.
Any cough or shortness of breath?
Just a little cough, but that's because I've been a 40-year smoker. And then I stopped. Just randomly stopped all of a sudden 5 days ago, so I still got that.
So are you coughing anything up or just
Yeah, just a little phlegm.
what does it look like?
It's yellow. I mean, white-ish.
Small amount?
Yeah, small amounts. Cough is not that bad.
Is it thick, thin?
It's kind of thin.
Any shortness of breath when you exert yourself or walk or
This kind of cough.
Yeah, I got you. Any chest pain, like with your heart? You got that port placed recently. Any other like wounds or any bruising, anything like that? Any difficulty moving your arms or legs?
No.
Any recent falls in the last 3
Oh,
months?
thank God, no.
So, are you having any nausea right now?
No.
Any diarrhea, constipation?
A little bit of constipation.
When was the last time you went?
Yesterday?
Do you take anything for that?
I take
Stool softener?
I took some Pepto yesterday, couple of tablets.
Any pain or difficulty with urination?
No. Been drinking lots of water with lemon. I drink lots of water with lemon, so, yeah.
So the lemon you may or may not like that when you do chemo. Couple of reasons. One, it may not taste good. But also because it's more acidic, your mouth might be sensitive because chemo can cause mouth sores.
Uh-oh.
So just be aware that that might be uncomfortable. So
Let's pour that out.
you're okay now. You're okay now. But you know, if in a couple of days it doesn't taste good or
Right.
it hurts your mouth, don't do it.
Okay.
But sometimes just plain water doesn't taste good either. So people will do whatever they need to do to like make it taste better. You could, I know it's also acidic, but like when my mom was on chemo, she would do like an ounce of orange juice to like 12 ounces of water just to like give it some sort of flavor.
I got some.
Or she would do like an electrolyte drop in there, or flavor drops, or Crystal Light, or something.
That's what I got. I got some of that in my car.
Mm-hmm.
Some it's the IVs.
A liquid IV, yeah.
Yeah,
Mhm.
I got a bunch of those in my car.
Yeah.
So.
So that kind of stuff is good. It's fine. Whatever you got to do to get those fluids in.
Gotcha.
You know, it doesn't have to be pure water, but as long as it has no caffeine, then it counts for hydration.
Right.
Caffeine is a
Just
diuretic.
don't do it
so.
with the lemon. I could do the water, but
Caffeine's
just
a
Yeah, but as tolerated. I'm not saying like don't do it, but if you notice it hurts your mouth, you have mouth sores, or it doesn't taste good, then don't do it. Yeah. And that stuff goes away when you're done with chemo. It's just a temporary side effect of it. Do you have any numbness or tingling in your hands and feet? Any vaginal bleeding? Any other concerns, things I haven't asked you about yet?
what was the question?
Oh, it was not concerning her. It was like when she's on the chemo, like when she goes home for the next 20 days, is the medicine still shrinking and working, or is it just working while she's here?
So it stays in your system and is working over, a longer period of
Okay,
time.
yeah.
In terms of like chemotherapy safety at home, your body has gotten rid of it after 72 hours.
Oh.
So like the double flushing the toilet, barrier protection when you're intimate, things like that, that applies for 72 hours after chemo.
So
Darn it! Darn it! Oh, I was trying to get away from it. Okay.
we were told we can't.
For the next 6 months,
Yeah.
Who told you that?
I think she didn't explain it well.
She
Yeah.
didn't explain it.
So, yeah, I think that's what it was. She just, yeah.
It's gonna happen for 21 weeks.
That's what she said.
That's what she said.
No.
We
Yeah.
looked at each other
Like,
like,
who does that? Yeah.
No,
you want a divorce now?
No, so barrier protection is fine because it's present in all of your body fluids.
Yeah.
So you just want to
Yeah, she was more concerned with, like, hugging the grandbabies every now and then.
no, and
Like
that's totally okay.
sweating,
See.
sweating.
Yeah.
If I'm sweating, don't. Well, I'm not gonna hug her no way.
72 hours.
Yeah.
And then it's out of your system
Oh, yeah.
for that. And it is still, working on the tumors.
That's
But we have it spaced out because we have to give your body a break to recover because the chemo is attacking not just your cancer cells but some of the healthy ones, and that's where your side effects come from.
Gotcha.
So we gotta give your body time to recover, especially your blood counts.
Okay.
So like you come in tomorrow for an
Right.
injection to boost your white blood cells.
Right.
And then at the 10-day point after treatment, you come in for a lab appointment here, and we're checking your blood counts on that day.
Okay.
The 10 days after chemo, about 10 to 14 days after, is when we expect your blood counts to be at their lowest. So we call that a nadir. That's the low point in your blood counts after we gave you chemo. And we want to know, what are they at their lowest? Do we need to intervene? Do we need to change your doses next time? Things like that. So we're closely monitoring all that stuff because it is attacking the blood cells, air cells, skin cells, and mucous membranes, which is your mouth all the way down to your anus.
Right.
So hence, like, it causes diarrhea. Some people get constipation, so it goes either way. Nausea, mouth sores, watery eyes, runny nose, dry skin. Can cause darkening of your fingernails, hair loss, all that kind of stuff.
I ain't worried about the hair loss because I randomly shave it bald.
Okay. So good for you. So the hair loss typically will start in about 2 weeks after the chemo, and you'll notice, we lose hair all the time anyways. You'll notice that it's more as you're losing hair. It's not like you're just going to lose typically like a clump on the left side of your head or anything.
Like Myra or Martin.
You'll just notice that you're losing more hair, and oftentimes people will just be annoyed by that and just shave it off at some point because they're like, this is just a pain.
Shave it off.
Yeah, I'm tired of picking up my hair everywhere.
Exactly.
So, you'll notice that, but it all grows back afterwards. Your nails grow
About
back.
my eyebrows.
You may or may not lose your eyebrows and eyelashes. So everybody's a little bit different. We'll have to see.
Don't look like I got eyelashes anyway.
Yeah, you're not even worried
I'm still
about that.
cute.
Yeah, you're not worried about that.
Are still cute. Okay, so let me go get your pre-meds.
Nice try.
So pre-meds here, you took the dexamethasone, the steroid already at home. So I'm going to give you ondansetron for nausea.
Okay.
Those little pills that
No, I
melt
got
in your
some
mouth.
in here.
Oh, I'll give you some, so you
okay.
keep your home stuff.
Cool.
And then I'm going to give you a medication that's IV, so through your port. It runs over about 20 minutes, and it's a long-acting anti-nausea medication. So it should kind of take some of that edge off for the first 3 to 5 days, which is typically when nausea is the worst.
Right, right.
So I will go get that. It's called Emend or Fosaprepitant. It's about 20-25 minutes to go in. And then as soon as that's done, we'll go ahead and start your first drug. So you have 4 drugs that are an active part of your treatment. The first 2 are immunotherapy, and the last 2 are chemotherapy.
Okay.
So the first one's going to take an hour. That's called pertuzumab or Perjeta.
Yeah.
Or Pujeta.
Right.
That's the nickname because it can cause diarrhea, so Pujeta. So we give that over an hour, and then we're going to run nothing for an hour and observe you to make sure you don't have a delayed reaction from it.
Gotcha.
Then we'll run the trastuzumab or brand name Ogivri for you. That runs over 90 minutes for the first time. Both of those drugs run longer on the first day. Number 1, because it's the first time you're getting it, and number 2, because the doses are bigger. It's like a loading dose for you.
Right.
So subsequently, each will run over 30 minutes. So it'll get much shorter for your next treatments. As soon as the trastuzumab is done after the 90 minutes, we'll give you your first chemotherapy. The Taxotere or docetaxel runs over 1 hour. That is the one that is most likely to cause an allergic reaction if you were to have one to a drug while you're here. It could happen to any of them,
Right.
but that one in particular, we're always like spidey senses up just a little bit. And what I say to all of my patients is, after I start a medication for you, if you feel anything weird or different in your body, I want you to press that red button and tell
Trust
me
me, I'm
about
gonna
it.
say something.
Because I want to know. I can come in here and I can say, oh, that is normal, or I'm concerned about that. I'm going to stop your drug and respond to it.
Okay.
So if you feel something weird or different and we're concerned, the first thing we're going to do is stop your medication. Then I have emergency medicine that I can give you. So I have Benadryl and I have Solumedrol, which is another steroid I'll give you through your port.
Okay.
We also have an EpiPen, basically. It's an epinephrine injection, should it be that advanced, okay?
Okay.
We deal with these reactions all the time. But what you may see is a whole horde of nurses coming in here, because if I need help, I'm gonna press the button that calls all my friends.
Right.
Okay?
Y'all get on
The
it.
special
Yeah.
button.
Yeah, so, don't be scared by that, we've got you,
Oh.
we do this all the time. So that one runs for 1 hour, then your last one only runs for 30 minutes.
Oh,
And
okay.
you're done, I'll check with you, make sure you're feeling okay, recheck your blood pressure, everything looks good, we de-access your port and you get to go home. So that's kind of my plan for today.
So when they give you the last one, call me,
I will.
and I'll be right
You're not
down.
hitting in here all the time.
No. I'm an entrepreneur.
Gotta go make the money.
Yes.
Gotta make this money.
I don't.
But thank God he's right up the hill.
Yeah.
Just 3 to 5 minutes.
That's like I wouldn't want nobody. So I go to dialysis. So I wouldn't want her to sit there for 4 hours with me
Yeah.
either. Go get the money.
Trust me, I used to.
We do, just so you know, we do have a family room that's actually like, not this door, but there's one around the corner right there.
Oh,
So
okay.
there's like a couch and a table.
All I
and
need is my
gloves and
laptop.
stuff if you need
Yeah.
your laptop. Yeah, I
That's
mean, so
it.
you're welcome to like work from in there too
Oh,
if you want.
cool,
There's
cool,
not
see?
usually a ton of people in there.
Yeah.
It's new to us being in this new facility for a couple
Right.
of months, so we're not used to telling people about it, but it
Yeah.
does exist.
Yeah, well, that I might do that because I know I'm gonna sit in the cafeteria for a while
Yeah.
and eat. Then I can just come up here, bring
Yeah,
it
you
up
can
here.
do that. You can sit
Yeah.
in there
Just
and
chill.
whatever.
Okay,
There's
yeah.
a little fridge in there if you want to put something in there.
Oh,
There's a
okay,
microwave if
yeah.
you want to heat food up for her.
Yeah,
Oh, wow.
cause I work
You're
from
welcome to
home.
eat.
I was gonna ask that.
Yeah, I work from home so much. It'd be nice to just sit here, you know. As long as I got my
Yeah, have a
laptop
separate
making my
office.
TV commercials, yeah,
Yep.
I'm good.
Everything in
Yeah.
there. Are you Roger?
Yes.
Okay. I have your phone number, so if she had a reaction and wanted me to call you or something, I have your
Yeah.
information.
Question, can I get ice chips and stuff too?
We do not have ice here that we can give our patients. It is an infection prevention thing. So he can bring you ice from the
Okay.
cafeteria
Gotcha.
or from home or wherever, but I can't give you any ice.
Gotcha.
They can't even do that at the kidney center. I told you they don't. Even, we got ice machines, but they can't give it to us. We got
Yeah.
to bring our own ice to the chair.
Yeah.
Oh.
Yeah. Yeah, like we have ice, I could put it in a bag for you to like ice something on your body,
Right.
but I can't give it to you
Yeah.
to eat.
Gotcha.
That's why when I bring my tumbler to dialysis, it's just full of ice. I just fill it with ice. Yeah.
Well,
If you
can
can
you
get
put some ice in there
Yeah.
before you leave?
I'm gonna go get
You got water.
your pre-meds. Do you want me to bring you a blanket when I come back?
Please. Thank you.
Bring you a blanket, you got heat, you got massage.
Yes,
right
I
there.
feel everything. I feel
The
everything.
lever to put this down if you wanna get up is just the lever over there on the
Right
side of
here.
your chair. And I'll be right back, okay?
Thank you so much.
Thank you so much.
So you can hug your grandbabies after 72 hours.
Wait.
Tell me before that.
Don't hug me.
Oh, and you, like, it's okay, like, in that 72 hours, like, you can kiss him and stuff. So, just no, like, heavy spit swap and stuff.
Right.
But you can give him a kiss, and you can give him a hug, and you can sleep in the same bed, and you can hug each other and all that, okay? Yeah.
Why would you tell her all that?
Yes, you heard her.
Why would you
Sorry.
tell her all that?
As you
Keeping her sane is what I'm doing.
sounding cracking.
Okay.
But you know what? She's so informational.
Yes, we learned a lot from
Oh,
her.
we learned a lot today.
Right,
So listen.
so you're about to get your medicines, and like I said, when they give you that last one, that's
I'll
when you
call
call
you.
me.
I'll call
I
you.
may be back before that though. Like I said, because I may be back before that.
Yeah.
They got a room I can sit
Yeah. Yeah, absolutely. You could chill and
in, upload more videos. Make sure to tell everybody like, subscribe, and comment.
you guys like, subscribe. I was subscribed. I'm sorry. I took meds. And just, just really support me, guys. This is my journey and it's about to go down. You're going to see the raw footage. Nothing edited. Over and out.
People call something like, my bag's not dripping.
Right, huh? Call somebody, the bag ain't dripping.
It is just not the one you think. And trust me, if there's something wrong with the machine or anything like that, it will tell me.
Oh, yeah.
Oh,
you'll
it'll
hear it.
tell me.
Yeah.
come find our, here, I'm gonna take this up on your slides. We come find the beeps, but if nobody comes quickly, you know, I might be over medication or something, you can press your button. So just the top one is dripping.
You're off and running. For the first time, you're off and running. For the first time.
Go.
Okay. You got everything running. This first bag is 20 minutes. And so they said you might feel something, you might not. So here we go.
Well, my body is strong enough for it. Well, it is. Let's put that out there. It is strong enough to handle this. I'm not going to say hope anything.
Right.
Yeah, we're going to get through this first round.
Exactly. 20-minute drip. You guys see it's dripping. We're using only the top bag, not the bottom one. You see it dripping. All right, Aries. Tell everybody like, subscribe, and comment, and we're out of here.
All right. Bye, you guys. Allergic reaction to this?
I told you, not everybody. That just, they know some people
Well, no,
do.
that's what she said.
Okay, so tell me, okay, I'm back now, and it's, God, maybe close to 2:30. What's been happening since I left?
So far, you know, I've gone through, this is my third one. I have 4 of them I have to do today.
Right.
That's the third one, and in 1 minute, it'll be done. Then I'll be on my 4th major one,
And how long is that?
and it's 1 hour.
No, I thought it was 30 minutes.
Is it 30 minutes? I'm sorry, I misunderstood. 30 minutes.
That's right,
30 minutes.
Okay.
Jeez. Might as well put my shirt back on. Joking. But no, it's been good. You
How you
know.
feeling?
Right now, I feel sleepy, real sleepy, but I'm trying to stay awake.
Oh, gotcha.
Can you go on this side?
Yes.
I am just trying to stay awake
Right.
until I get home.
What'd you do to pass the time?
Last time I talked to my babies, I've talked to my friend Amanda. That's my love. That's my girlfriend in my head. You know, we let our babies talk to each other.
Oh, Lord, not this stuff.
Well, she's got hers and I got mine. Yeah, so we let the sisters talk on video. And yeah, talk to my fans on Facebook, and it really helped the time go by. And
Your channel debut today.
channel debut will be next week.
No, it was today at
It
noon.
was today at
That's
noon.
how everybody
Sorry.
watched it.
Today at noon. By the court one was today at noon. So please, you guys, watch, subscribe, share. Okay? Share that. And then today's events will be out next week. Okay? I'll update you guys. Over and out.
Can you tell us anything?
Well, you guys, I am finally done with 4 rounds today. 4 bags.
From
They
8,
were
from 8 p.m. and now
yeah,
it's 3
from
p.m.
8 a.m. till 3 p.m. It was a long day for me. I'm glad next time I come, it won't be as many. I'll be doing 3 bags.
So,
And then it gets less and less and less. And my tumor will start to shrink.
so we'll let you get dressed and everything. Then we'll talk to you again when you get outside.
Hey, I just got done with my first round of chemotherapy, the major one, the beginning one. So I got 4 more to do within 3 weeks. So,
Okay, and any other concerns or anything?
No,
that we need
that's
to address? You're good?
No, you know, if I have any questions, I will call you guys because, yeah,
Okay, great.
I know I'm
Great.
gonna need some
Uh,
assistance in something.
okay, yeah, no, we're here. So, if something comes up or you have further questions or even, need some assistance on paperwork and stuff like that, with the
Yeah,
short-term disability or anything, we're here to help you out. So just give us a call.
I appreciate you calling me. Thank you.
You're welcome. You have a good rest of your day.
Okay, you too. Thank you.
All right.
Bye bye.
Bye.
Okay. Oh, whew. Oh, wobbly.
So what was that call about?
Well, they this is Valley Medical, and they want to know how they can assist me in getting onto short-term disability because my cancer team feels that I might need to do that instead of just a personal leave.
Instead of going back to work
Yeah,
and all that.
going back to work, intermentative or whatever you call that. You know, a couple of days here, a couple of days there.
Right.
I have to stay off for a while until
Right.
it's all completed.
Okay.
So we're keeping our fingers crossed that after September, it should be a wrap. That will be my first major breast surgery, the major one,
And
the big
everything will be
dog.
gone.
And then the tumor will be gone.
You'll
We're gonna get on back
you'll be
to
ringing
basics.
bells.
Yes.
Official survivor.
Yeah.
All
I'm gonna
that.
get me a shirt that says Survivor.
All right.
Yes.
I kind of like that rock fashion shirt you're wearing.
Oh yeah. That's right. Rock Fashion's right here.
I kind of like that rock fashion
Yes.
shirt. So,
And this is my granddaughter's fit right here.
yeah. So we walked in this morning.